For millions of people, diabetes isn't just about managing blood sugar. It often comes with something truly debilitating: constant, agonizing nerve pain. But what if the key to treating this physical pain wasn't just in the body, but actually in the mind? So let's dive into this hidden link that's totally changing how we understand and treat this condition. So, what is this hidden link? Well, we're going to decode a crucial connection that doctors are now using to create a much more effective roadmap for relief. We'll be looking at some fascinating research that untangles the super complex relationship between diabetic neuropathy, depression, and anxiety. Okay, so first things first, we've got to understand just how huge this problem is. And it all starts with the sheer number of people living with diabetes. Get this. The International Diabetes Federation says that a staggering 11% of the entire global population is affected by diabetes. That's hundreds and hundreds of millions of people managing this chronic condition, day in and day out. And that's where things get even more complicated. Because out of all those people with diabetes, research shows that up to half of them will develop neuropathic pain. I mean, this isn't some rare side effect we're talking about. It's an incredibly common, life-altering reality for so many.
And we're not talking about a simple ache here. The sources describe the feeling in such visceral detail. Patients talk about feeling burning, electric shocks, and stabbing pains. And to make it worse, conventional painkillers, they often don't even touch it, leaving people in this state of chronic, really hard to treat pain.
But the story goes way deeper than just the physical pain. This condition is deeply, deeply intertwined with a patient's mental well-being. In fact, they're often inseparable, basically two sides of the same coin. Just take a look at this. The overlap is incredible. In patients with type 2 diabetes, the rates of other conditions are just sky high. Nearly 40% deal with sleep disorders. Then you got anxiety and depression hitting 18% and 17% of people, respectively. See, these aren't isolated issues. They're all part of a much bigger picture. And that brings us to this really key idea, what's called a bidirectional relationship. It's kind of a fancy way of saying it's a two-way street. It means diabetes and depression don't just happen to exist at the same time, they actively make each other worse. Poorly managed diabetes can worsen depression. And of course, depression makes it way harder to stick to a treatment plan, which then worsens the diabetes. It's this brutal, vicious cycle.
So you can see why finding the right treatment is a total puzzle, right? Doctors aren't just treating nerve pain. They're trying to untangle this whole web of interconnected physical and mental health issues.
Yeah, your usual painkillers, they just don't work here. So doctors have to turn to specialized medications, often things like antidepressants or anticonvulsants. But these are not simple fixes. They come with their own whole set of complex side effects and risks that have to be weighed really carefully. Let's break down some of those hurdles. For instance, there's an older class of drugs called tricyclic antidepressants, or TCAs. They can have cardiovascular side effects, which is a huge concern for diabetic patients. Other drugs carry a real potential for abuse. And some of the most common antidepressants we use today, SSRIs, well, the results for nerve pain have been kind of inconclusive. You see, every single prescription is a really delicate balancing act. So how on earth do doctors navigate this maze? Well, the research we're looking at lays out a super clear, personalized roadmap that actually takes the whole patient into account. Let's see how it works. And this flowchart is the key to the whole thing. Instead of some one-size-fits-all approach, it gives doctors a decision-making tool based on the patient's specific mental health symptoms. Honestly, it's a simple and pretty elegant solution to a super complex problem. So let's walk through it. Step 1, you don't just look at the pain. You also check for depression and generalized anxiety disorder, or GAD. Now, if anxiety is the main thing, certain drugs are recommended. If it's depression, you've got a slightly different toolkit, including those TCAs. And this is a big one. If both are present, the choices get even more specific, narrowing down to the medications that can tackle both at the same time. What this map really does is point to a much bigger idea in medicine. The idea that to be truly effective, you can't just put a Band-Aid on one symptom. You have to treat the whole person. And that's the big takeaway, really. The most effective treatment for this kind of pain is what they call an integrated model. The right medication is absolutely vital, but it has to be combined with preventative care, with educating the patient, and with physical activity. It's about attacking the problem from every single angle. So that leaves us with this one big final question. This research clearly shows that by carefully considering a patient's mental health, we can be so much more effective at treating their physical pain. It really makes you wonder, doesn't it? As we uncover more and more of these deep connections between our brains and our bodies, maybe treating the mind really is the future of healing the body.